There has been a 9% decline in fertility from 2010 to 2019.
Is it safe to continue to use it?
There are some known potential birth defects related to that medication. And you're trying to feed your baby. You're trying to make sure that you're gaining weight appropriately during pregnancy.
Little health and a little wealth and a lot of love. That's the life that we live. Suits and scrubs.
Hello, everybody! Welcome to another episode of Suits and Scrubs, where we talk about a little bit of health,
A little bit of wealth,
and a lot of love. To join me is my co-host. She's a gut, hormone, and weight loss doctor. Spending time with us, you can heal yourself from inside out.
And I am joined by my co-host, Mr. Zachary SVP. He will teach you how to retire before 40.
That's us. All right, guys, so we have a really exciting one today. Honestly, I have not heard of this, so I'm just like, what is this? It is Ozempic Babies. But before we jump into that, someone said the word. Every episode we have one word, another person says it, then they have to spin the wheel punishment. And this attributes to, we like playing family games, so we bring family games inside of our show. Makes us different? I don't know. All right, go ahead and take it away.
So yes, I landed on Songbird. And that basically means that I have to sing a little song for everybody. And I'm trying to keep it in theme with our episode today.
She did do that. I was actually very impressed with the song she chose.
Apologize if I'm a little bit tone deaf. Okay, are we ready?
We're ready.
The one you warned me all about. The one you said I could do without. We're in an awful mess and I don't be maybe. Please, Papa, don't preach.
Oh.
I'm in trouble deep. Papa, don't preach. I've been losing sleep.
What?
But I made up my mind. I'm keeping my baby.
She's what?
Oh, I'm keeping my baby.
I felt like being a little Migos with this. Yay!
Thank you for being my woo girl for that.
Yeah, of course. Always your woo girl. All right, guys. On this episode, we're talking about Ozempic babies. What are they? Does Ozempic cause it? Whatever it is. And we're going to have her explain what that is. And then what measures should take in place in the event that you have an Ozempic baby. That's really a thing. All right, so we're going to jump into our first segment, which is Refractions. Refractions!
This is my Ozempic baby.
It's a new phenomenon. Women struggling to conceive go on the weight loss drug, then out of the blue, become pregnant. Deb Oliveira says she was plagued by fertility issues, but is now 10 weeks pregnant after going on Ozempic to lose weight. Here she is in shock after taking not one, but 3 pregnancy tests that were all positive. And she says she was on birth control when she got pregnant.
I had no idea the effects of fertility that this medication had.
Taylor Smith also calls her 4-month-old little guy an Ozempic baby.
We were over the moon, but shocked.
She says she'd suffered from years of fertility problems and was taking Ozempic to lose weight when baby Logan suddenly came into their lives.
Wow, okay. So what's your reaction to this phenomenon we're calling Ozempic babies?
Yes, and so it's like a double whammy because it's not just the fact that people are more fertile after taking the medication, it's that it's potentially impacting their birth control and specifically hormonal birth control. So we will dive into that with today's episode and tell you all about the fertility after taking these medications, but also which birth control methods you should be using while on these medications.
Interesting. So what you're saying is it is a thing.
Yes, it is certainly
Wow.
a thing.
The next segment is Under the Microscope.
Under the microscope. We are going to be talking about a little bit of a deeper dive. We'll talk about the specifics behind a certain topic. And today we're talking about fertility. And we're specifically going to be talking about the decline in fertility that we've seen not only the last 50 years, but even really just the last 10 years, the last 5 years. There has been a 9% decline in fertility from 2010 to 2019. And I think it's important to consider why that is. I think there's a lot of socioeconomic issues at play. Not only women are entering the workforce more, women are more interested in higher education, and so they're putting off pregnancy. And then I think there's also this access to birth control that maybe wasn't something that was readily available in the past. And so people have a little bit more control over having a family now than they used to.
And I think some of the economic recession for sure, and this is not a wealth episode, this is a health episode. We did talk about some of these things. Actually, our episode just dropped, Financially Ever After, like what wealthy people do before they say I do. Definitely something to check out.
Yeah.
So,
And that's a good point. We do see that fertility rates decline with recessions or with Great Depressions. We saw a decline then as well. And then typically we see it recover shortly after, and we haven't really seen a recovery yet.
yeah. What pops in my head is I'm tickled to death by this, but one of my friends said this, and a female, she says, I ain't having sex until the economy's getting better. I was like, dang, all right, I hear you. So, what a great transition. All right, Emily, you teased us enough. What are Ozempic babies, and why is there so much attention surrounding them?
So Ozempic babies, and everything is tied around the word Ozempic now. And so
True.
we can back up a little bit for those who
Newsflash, BR2.
who have been living under a rock for the last year or two, who don't know what Ozempic is or these other medications. So Ozempic is actually the medication that's more for treatment of diabetes, but it has become popular because of its implication in weight loss. And so there are two specific medications, or technically three, but two newer medications that are out on the market now specifically for weight management, and it is Wegovy and Zepbound. Those are the two that are similar to Ozempic. And so they're GLP-1 agonists. Basically, they're hormone mimics, and they're injectable weight loss medications that you inject once a week. And these medications are very effective at helping people lose weight. And what happens when you lose weight? Your hormones tend to improve. Your insulin resistance tends to go down. And insulin resistance is truly one of the main factors that is implicated in infertility for women. And for all women, I think women with PCOS in particular.
That's
so
right.
when you have more fat, when you have more adipose tissue, that adipose tissue is converting things into different hormones. It's creating different signaling molecules and different chemicals that's basically impacting your inflammatory status, your inflammation in your body, your insulin resistance. And if you have more of that, then you have more hormonal imbalance. If you have less of that, you have less. And we're seeing that these Ozempic babies are happening, number one, because we're seeing improved insulin resistance in women. They're losing weight, their insulin resistance is going down, their hormones are starting to balance out, and they're just more able to have children.
So you're saying that there's a correlation between weight and fertility.
Yes.
Because it's not a prejudice thing. It really truly is the fat will translate things into different hormones. Is that what you're saying ultimately?
Yes, your fat tissue has different enzymes that converts one hormone into another. And so if you have more of that fat tissue, then you're just converting more hormones and you're causing more of that hormonal imbalance. But it's also that kind of the inflammatory response that we see from those fat cells that leads to the insulin resistance and leads to issues conceiving.
Gotcha. So with these injectables, how does that impact fertility based upon just losing weight and, oopsie baby or Ozempic baby is what they're saying.
Yeah.
So this phenomenon is actually really true. But let's dig deeper here. Is it only just Ozempic or like just losing weight in general?
Really, I think losing weight in general definitely has a huge impact, but I think we're learning more and more about these injectable weight loss medications, the Wegovy, the Zepbound, the Saxenda. I think specifically the Wegovy and Zepbound that we're seeing an improvement in insulin resistance just with being on the medication. We're seeing this anti-inflammatory effect that I think is the root to some of this improved fertility. I've also seen people who have autoimmune conditions like lupus and rheumatoid arthritis who are talking about decreased joint pains and decreased inflammation just by being on these medications, not necessarily because of the weight loss associated with it, which I think is very interesting. We don't have a lot of research on that yet, but I think it's something that's coming, yeah.
So you're so pro that. Based upon, well, the thing is, again, patients day in, day out on this today, right now. This is all you do. You are the weight loss doctor, right?
Yeah.
You're the gut hormone weight loss doctor. So ultimately, you have firsthand experience, just the onslaught of patients that you see a day that basically their lives have really had changed and improved here. If you want a deeper dive into Ozempic, we do have another episode. We figured we'd do a follow-up.
Just a little
because y'all
plug.
want to know what Ozempic is and all that other stuff. And we did a whole episode on Ozempic face or whatever. But really, we dug deep. Is there any particular medical conditions, people that may be predispositioned based upon this
GLP-1.
GLP-1?
So PCOS is one that's very common in our population, and there is this huge tie to insulin resistance. And I would say these women probably, or we don't have specific studies on this yet, but I would say that they'll probably see the most improvement in fertility on the GLP-1s, or with weight loss in general. We're seeing that that lifestyle is very important for PCOS. So being able to eat a healthy diet and exercise regularly, following within certain parameters, that can certainly improve your fertility, but sometimes it's hard to get to that point because of the environment that we live in.
Right.
It's a steep hill to climb. And so I think that these medications can help get you on that path. So I'm not a proponent of just using the medication as a magic bullet, but also following those other guidelines. But I would say PCOS and women with diabetes or pre-diabetes, they will likely see an improvement in their fertility status if they are improving their insulin resistance and if they're losing weight.
So there's
in a healthy way.
So there's a direct tie to insulin and then also getting pregnant. Can you explain that a little bit more? I'm sorry if I missed that in the beginning.
It's usually insulin resistance is a sign of inflammation in the body in general. And that's your body's way of telling you that there's inflammation, there are chemical molecules that are not acting in the way that they should be acting. I think we're seeing it in a lot of chronic conditions now. If your body is constantly in that kind of fight or flight inflammatory response, you're not really primed for being able to have children, to procreate.
Sense. Yeah, that makes sense. Actually glad you dug deep into that because I wasn't drawing that connection between like hormones. I got the fat tissue creates more hormones, or it can create hormones or translate them into different hormones, but doesn't understand the insulin and fertility.
Yeah.
So that's helpful. Pretty much, if you are on Ozempic, and let's say that all that's getting sorted out with your insulins and things like that, you are getting pregnant.
There are other reasons for infertility outside of just insulin resistance. I'm not saying that you should just go on this medication to become fertile, because that's not the direction that I'm leaning in. I think the biggest thing is for women to be prepared for this to happen.
Gotcha. And then talk more about that preparation.
Yes.
I think this is common sense, but I think it's common sense. But
so that's the other side of things. Not only does the medication potentially improve fertility for women, but also can potentially decrease the effectiveness of certain types of contraception, like the oral birth control pill. And I think it's more something that we've seen more in clinical studies with the tirzepatide, which is this kind of double hormone weight loss medication that's the active ingredient that's in Zepbound and Mounjaro. And it's very effective for weight loss. It's probably the most effective medication that we have out there for weight loss right now because it slows your stomach emptying. There's a potential that it can slow the digestion and absorption of your oral contraceptive pills.
that makes sense.
They've seen this in clinical studies with the tirzepatide, not so much with the semaglutide and liraglutide, which are the other two injectable weight loss medications, so the Wegovy and the Saxenda. Not seeing that as much, but I think just out of an abundance of caution, we typically recommend if you're on this medication for weight loss, you should be using a secondary form of contraception. An IUD is typically not affected. Like the Nexplanon, the implant is typically not affected. That's bypassing the absorption in the GI tract. But if you're on the pill, you should be using a barrier method, like using condoms. But that is not the gospel that we teach on this podcast.
No, we don't.
But it is important just to be aware of that. And it's more specifically thought to be within the first 4 weeks of starting the medication or within 4 weeks of dosage adjustment. So it's not necessarily an ongoing issue. If you're on the medication, you're on a maintenance dose. But definitely when you first start taking it, it's good to be aware of that.
Gotcha. So guys, if you're on Ozempic trying to lose weight, make sure your contraception is in place, is what Emily is saying here. All right, so let's say that you find out you're pregnant and you're losing weight with these medications. Is it safe to continue to use it? Or what do you recommend in that scenario where, oh crap, I'm pregnant and I still on Ozempic? What do you think?
Yeah, so it's not something that we encourage at all for use with pregnant women. And if you find out that you're pregnant, it's important to immediately stop the medication and make sure that you're plugged in with your obstetrician and you have all the right prenatals and make sure that you have the right care in that respect. I think the biggest thing with these medications is that it's never a good idea to be on a medication that can help you lose weight during pregnancy because you're trying to feed your unborn baby. You're trying to make sure that you're gaining weight appropriately during pregnancy or you're maintaining weight in instances, but that you're giving nutrition to that baby, basically. And so you should never be on something that should prevent weight gain, the appropriate weight gain or nutrient status during pregnancy. That being said, there were some animal studies that showed that the babies had low birth weight or they had some skeletal deformities related to the use of these medications. We haven't really seen it in human studies. And of course, we're not going to do randomized controlled trials with pregnant women. Like we're not going to just experiment on pregnant women just to make sure that a medication is safe. And so you don't really see a lot of that.
Right.
You don't see a clear yes or no, this medication is safe. We haven't really seen that women who are accidentally on the medication and find out that they're pregnant, we haven't really seen many case studies to show that is 100% detrimental to the fetus. But I think to be safe, we usually recommend 60 days before you're trying to conceive, stop the medication to make sure that it's completely out of your system.
I think it makes sense because like our circle right now, this is so relevant to us, where we are in life. A lot of our friends are pregnant or getting pregnant or just have babies. Everything that you take into your body as a mother, as growing a womb, it's very special. And I could imagine if you are trying to conceive, like you are trying to, unless you're trying to lose weight so you can get into that healthy range, but that's your individual decision. What's interesting you said, I just want to piggyback off, is the weight loss medication. So it's not just Ozempic, it's any weight loss, not process, but any weight loss medication you're helping to lose weight. I think the common one like 50 years ago was phentermine, right? And these other ones like Topamax. And I remember having this conversation with you off camera. So anything else you want to expand upon that?
Yeah, so it's really not just these GLP-1 or GLP-1 GIP medications that are impacting, that can potentially be dangerous for pregnancy. It's really all of the weight loss medications, and specifically phentermine. It's the known kind of tried and true diet medication that we had for years before the Wegovy and Zepbound and the other injectable weight loss medications came out. And it's a stimulant. So there's a potential for increasing heart rate, increasing your blood pressure. And I'm not saying that it's not a useful tool at times, but it certainly should not be taken while pregnant or while trying to become pregnant. And there was a specific case study that I saw where the fetus did have an in utero stroke while the mom was taking phentermine.
What is that?
So they basically had a stroke. The baby had a stroke. So their brain was damaged in utero. And whether or not that was directly related to the phentermine, you can't really say 100%. But I think that's the biggest concern, is that being on a stimulant medication, you want to make sure that there are no cardiovascular risks. When a woman is pregnant, there are all these other hormonal changes that can increase risk of clotting and potentially increase blood pressure for certain women. And so you don't want to be on a medication that can make that even worse.
And so I remember watching 1,000 Pound Sisters, right? And then Tammy was like, I could be pregnant. I did not know a direct correlation between her losing weight has a stronger or higher probability of her getting pregnant. I just think that's interesting, just to sum up all the things that you're saying. Do you have any key considerations based upon the weight loss? Let's say people want to get on this weight loss medication to lose weight in order to have children. Is there things that folks can do that's safe? Or what do you recommend?
Yeah, and so I also back up a little bit, because it's not just phentermine that we use for weight loss, but often we'll use topiramate, Topamax, which is a medication that is also used for migraine headaches. And so that not only, there's some question about absorption of that medication and whether or not that impacts your birth control pills as well. But the other thing is that there are some known potential birth defects related to that medication. And so specifically, I believe like cleft palates, there's an increased risk of that in women who are on Topamax. And so it's important to make sure that you're counseling women of childbearing age, no matter what medication you're starting them on for weight loss. And for this one, also for migraines, making sure that they're aware of that potential risk so that they're taking all of the precautions that they need to.
This is probably a shorter episode, which is totally fine, but we just wanted to jump on here to let people know exactly what Ozempic babies are. And then we promise you a bonus at the end. So Emily, what is your bonus? What do you want to tell people about losing weight, fertility, infertility, and all that?
I think it's very encouraging for women. You can see from the Inside Edition, or the clip that we played in the beginning, how excited those two women were that they didn't think it was even an option for them anymore. They had tried infertility treatments and they still could not get pregnant after multiple rounds of IVF or other methods. And so this medication changed their whole life. And I think that we're seeing the demonizing of these medications because celebrities are using them, and it's in social media talking about how it's just vanity. It's just people trying to lose weight. It's just people trying to look good on their Instagram stories. And I don't think that people are realizing how life-changing it can be for all of these other reasons, how it's helping people get to the point where they're able to have children, how it's helping people who already have children be more active with their children and live a long, healthy life and still be there for their children. And so I think that's my biggest takeaway, is that we should be using these medications safely. We should be counseling patients about safe use. And especially women of childbearing age, we should make sure that they know of all the risks associated, that they know that they are potentially more likely to become pregnant, and make sure that they have those fail-safes in place. But I don't think that we should be putting a guilt trip on on our patients for using these medications because they
Yeah.
can be life-changing.
Yeah, I agree. And I think like we skate on this up quite a bit. We talk about the purposes of vanity versus do you have an opportunity to actually help people? And maybe we can dive deeper into that in one of our future episodes about the vanity reasons versus the actually like real life patients that you're seeing every single day that these medications are helping with. Ozempic babies, it's a real thing. Wear protection if you are on this. All right, guys. That's another episode of Suits and Scrubs. A little bit of health.
A little bit of wealth and a lot of love.
Until next time, guys. Peace out.
He's on the hustle, she's on the grind. There's no time to kill. Saving lives and new deadlines. There's some holes to fill. With a little health and a little wealth and a lot of love. That's a life that we live. Suits and Scrubs.